update for May 4th, 2020 on the state of the COVID virus and the response here in Jamaica. So within the last 24 hours, I'm pleased to announce that we have had only 2 confirmed positive cases of COVID-19 in Jamaica. So this brings the total to 471 confirmed cases on the island. 2 new cases are 1 male, ages 12, from St. Catherine, and 1 female, 20, from the parish of Clarendon. Both are contacts of confirmed cases based on the contact tracing. There are 221 confirmed COVID-19 cases related to the workplace cluster in St. Catherine, which constitute, of course, the majority of cases that we have had to date. At this time, there are 35 imported cases, 168 cases that are contacts of a confirmed case, 9 that are local transmission cases not linked epidemiologically, and 221 are linked to the workplace cluster in St. Catherine, while 38 cases remain under investigation. Some 291, or 62% of confirmed cases, are females, and the balance, 180 or 38%, are males. And the ages ranges from 2 years to 87 years. 11 more cases have recovered from COVID-19, bringing the total to 49 recoveries. So we're certainly seeing an increased number of recoveries, which is a very positive development. So we now have 49 recovered cases, and unfortunately, of course, we have 9 deaths. Just to reinforce what the Prime Minister said earlier, which is that we have seen a surge in cases in the last few weeks, but that surge has been linked to one particular cluster. And I'm sure the CMO will speak more to this. That surge does not represent the surge that we had projected or predicted, because it is not the sort of random, wide-scale cases that you would observe that are unrelated to travel history and that would show up across the country. This surge was created by one entity where there were issues, and that one entity has contributed fairly significantly to the numbers as outlined earlier. To date, we have identified, however, speaking now to the more random cases, some 36 cases through the respiratory surveillance system across the island. These cases have been identified in all parishes except Hanover, Westmoreland, and St. Thomas. And it is a reminder to the country, or should be a reminder to the country, that that surge is still likely, still possible, and therefore we cannot let down our guard as a people, as public health officials, as individuals going about our regular business. And it is a reminder to continue to recognize the advisories, the new rules of engagement, the wearing of masks, the social distancing, the proper hygiene practices, because we do expect that over time, living with COVID is going to mean that it could be anywhere at any time. And as a consequence, we all could be at risk in our particular location, wherever we are in the country. This is very important. It's also important that the country continues to support the efforts of the medical team in the field, the contact tracing, which is quite labor intensive and depends significantly on the support of persons at the level of the communities. When questions are asked, when information is solicited, that we cooperate with the team out in the field. I want to say a little bit on testing. So far, we have done some 5,830